Will existing vaccines still work to provide protection against the new Arcturus subvariant? Public health specialist Dr. Farhan Rusli discusses the need for a booster dose, particularly the bivalent vaccine, to protect against the newest variant.
So when you talk about immunity, especially about new vaccines such as COVID, you don't really know how long the immunity levels are to the most optimum. It can be a year, it can be 2 years, it can be 3 years. And what's more interesting is that it differs between individuals. For some people, it may last longer. For some people, it may last much lesser. And for some, it may not create the immune boost that you would want it to create. So even if you've gotten the vaccine, you may not have the immunity. And that's why we have this agenda of pushing for the booster doses. Now, the booster doses, the new ones that's out, are the bivalent, which means that they are not only covering one sort of the virus, but it covers 2 different sorts. That's why it's called bivalent. And it shows a very high resistance to the Omicron strain, which is what's being widespread right now. If you are okay to take an influenza vaccine every year, knowing that the strains change and what you've gotten last year doesn't cover for what is going to come for the next year, you can apply the same thing towards COVID. If you understand the principles of basic immunology, the basic principles of vaccination, then you would be able to grasp the idea of why the boosters are actually needed and why it's actually necessary. And this is the message that the Ministry of Health must drive. It must not stop driving this message over and over again.
Farhan also addresses health doubts and fears surrounding the COVID-19 vaccine, comparing the risks to over-the-counter drugs in the market.
In any sort of medication, regardless, even paracetamol, Panadol, right, there are risks that are associated with it, albeit however small. But it occurs in some small part of the population. Now, there is no one safety drug that is safe for all. There's none. It doesn't exist in the world. But the amount of risk that you take while you actually get the vaccination is so much lesser comparison to getting COVID in the end.